So PRP stands for platelet-rich plasma, and essentially what we do for these injections is we take a smaller amount of blood from the patient's arm and we spin it in a centrifuge, and this separates out the platelets in the blood. So we get an area of the blood which is condensed with platelets, and we then inject that into the patient's joint usually, or it can be into soft tissue such as a tendon. So PRP has been shown to be particularly useful in the treatment of osteoarthritis of the knee, and this is where most of the studies have looked at. The good news with PRP is when patients do find it effective, the benefits seem to actually last for a very long time, and there's certainly studies that are showing that patients are reporting benefits even over a year after the treatment. PRP normally is a program of 3 injections. So typically we will bring a patient in once a week over a course of 3 weeks. We can advise, or patients can obviously opt to just have a single injection and to see whether or not they find that to be beneficial. And that is also an option that we provide as well. PRP, or platelet-rich plasma, is originally sort of thought to be sort of pro-healing and pro-regeneration, and certainly that has been the sort of science behind sort of evolution of PRP treatments. However, I would say that increasingly now people are recognizing that certainly the benefits in the short to medium term are most likely to be an anti-inflammatory effect that occurs within the joint or occurs within the tissue. So preparing for your PRP treatment, just to be aware of the fact that on the day the procedure will involve taking blood from the arm, and then the treatment of the blood, and then the injection into the body part. So the actual consultation will be more like 45 minutes, to just allow a little bit of extra time for yourself on the day. We do ask that patients, when they attend, they should be well hydrated, so just drink regular water for 2 or 3 days in the lead up to the day of your injection. That just means that it's much easier to take blood, and we get a much better yield when we're taking blood if patients are nicely hydrated. And also, we also ask patients to avoid taking non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen in the lead up to the treatment, and then also for around a month or 2 after the treatment, because we know that non-steroidal anti-inflammatories again may detract from the benefits of the PRP treatment.